Hello, everyone. I am here to present a proposal for a perioperative nurse residency program that will make our perioperative environment the best OR in the state of New Jersey. Welcome to all stakeholders, administrators, nurse educators, and future preceptors. My name is Patty Hoffer, and I am an operating room nurse here at Robert Wood Johnson University Hospital. This presentation will highlight the reasons and the need for the nurse residency program. So let's begin. In New Jersey, the healthcare industry experienced a huge job loss due to COVID 19. However, it is said that the outlook for healthcare employment is looking up. From 2018 to 2028, it is projected that 64,860 jobs will be added, which is an annual increase of 1.2%. New Jersey's healthcare workforce is more racially diverse than average and does not currently face the magnitude of unemployment as in other industries. Our healthcare sector can be divided into three major areas: ambulatory healthcare services, hospitals, and nursing and residential care services. These three healthcare components have grown by 2.9% annually since 1990. There are opportunities for employment for all levels of education and experience. RWJ Health has a long-standing relationship with Rutgers University and its two medical schools, where they are able to access the latest in medical research and treatment technologies. Today, many nursing programs do not incorporate specialty nursing areas into their curriculum. Therefore, it is important that nurses get exposure to the perioperative environment before they seek employment. This internship is designed to be an introduction to the perioperative program. After graduation, students will continue into the perioperative program where they will increase their knowledge, skills, and abilities that will be further evaluated. So, what value would this program bring? First of all, is the process of bringing about a planned change. It is a deliberate and collaborative process involving change agent and client systems, which are brought together to solve a problem. Planning helps with discovering and preparing the way for action that should be taken. When there is a need for a change, proper planning is important for achieving success in any work. That is why we are here today. Any questions so far? Okay, let's continue. As I have previously stated, COVID 19 and its increased nursing shortage has not made it easy to recruit nurses with the necessary qualifications into the perioperative setting. It can cost up to $120,000 to train a new perioperative nurse. It is also believed that the financial burden for facilities is only expected to increase if the current shortage of nurses continues to grow. Therefore, it is necessary to introduce students to perioperative nursing while staying ahead of the nursing shortage into the perioperative setting. This perioperative internship program also needs to be implemented because nurses are leaving the OR environment during and after their training. Perioperative nurses were interviewed about their OR experience. Some of the responses, when asked, "Why are you leaving?" "It wasn't what I thought it would be," "It's not the type of nursing I want," or "It's just not for me." The operating room is not like any other unit. Qualified nurses play an important role in the operating room before, during, and after surgery. During and after the perioperative program, nurses are realizing the intensity of their role and responsibilities. A good return on investment for hospitals when nurses decide to remain in the operating room after they've been trained. Having an internship to the perioperative environment allows nurses to get firsthand experience on what the roles and responsibilities will be like after graduation. This experience will allow them to decide if this is the true path they want to pursue after graduation. As I have previously described, the learning modules of this course will be fully virtual and will reflect the current advances in technologies and processes. The educational learning lab will be utilized for learning modules. Simulations will be performed in our simulation lab. Their clinical learning experience will continue to the main operating room. The time frame will be approximately 4 months. The final week will include a comprehensive test to determine students' knowledge and ability in order to move into their clinical rotation. Here's the outline of the program and learning objectives that students must meet to be successful in their residency program. Attached will be the perioperative internship curriculum that will be given to each of you for review. You will see that it meets all the criteria for patient care and safety while working in the operating room. Listed are the 6 main areas in red that will be covered. So, how do we know that this design and delivery of our program will be effective? It is said that developing systematic and strategic program evaluation approaches can help us determine the value and worth of a program. Also, using formal and informal opportunities to collect formative and summative evaluation data. Finally, we have to also think about how the data will be collected and analyzed to measure our return on investment. We will incorporate a transfer of learning strategies and evaluation plan that will be designed to show the roles and responsibilities of those involved in their evaluation strategies used to determine that the transfer of learning has occurred. Each strategy is listed according to when it will be used and who will use it. Nurse educators and preceptors will be using both forms of assessment to track students' progress throughout the program. These assessments help what should be improved or changed in a program while it's in progress. Formative is a way of assessing a student's learning in real time and evaluating their learning as it progresses. A summative assessment is used to evaluate student learning at the end of an instructional unit by comparing it against some standard or benchmark. Summative evaluations also serve to help make changes or modifications for a future program. Robert Wood Johnson prides itself on being one of the most diversified hospitals in New Jersey. The nurse residency program is targeted towards senior nursing students at Rutgers University in their last semester of school. Through interviews, the nurse residency program will comprise a diversified student population, including first generation, traditional, and non traditional senior nursing students. With the help of our nurse educators and preceptors, it is our goal to meet the challenges that new graduate students may be encountering during the residency program. It is important to integrate new students into the culture of an organization and have them become familiar with the specific policies, procedures, and routines. With the help of our nurse educators and preceptors, it is also our goal to meet the challenges that new graduate students may be encountering during their residency program. Again, as new graduates, it's also important that they feel supported by the residency program, their leadership, preceptors, and other students within the program. New graduates face many unforeseen challenges, no matter what their fears are, concerns, or challenges. It will be up to the leadership team to ensure that students get the best experience during their residency program while minimizing any encounters they may face. It is my hope that again, Robert Wood Johnson will seek accreditation from the American Nurses Credentialing Center as well as from the Commission on Collegiate Nursing, which we already have an accreditation approval for our general transition to practice residency program. To reiterate again, the operating room is a highly specialized area that requires an intensive training for nurses who share a passion for advancing perioperative nursing as well as ensuring patient safety and optimal outcomes. It has been difficult for Robert Wood Johnson University Hospital to retain nurses due to misconceptions of the day-to-day operations in the perioperative environment. This proposal is being presented to provide graduating senior nurses an opportunity to get an internship in the operating room with the hope to increase student awareness to the perioperative nurse as well as recruiting nurses after graduation. We know that a successful student will have increased knowledge, skills, and abilities to the perioperative environment. We also feel that students will have a successful experience where they will make the commitment after graduation to come on board as a perioperative nurse. Our successful program will create happy, competent, motivated nurses with increased confidence in their new professional roles. These are our future perioperative nurses here at Robert Wood Johnson. Welcome aboard. I would like to thank everyone for watching my presentation on my proposal. More importantly, because healthcare is forever changing, it is my hope that RWJ will consider this proposal to not only prepare graduating nurses for the perioperative environment, but to better serve our community and patients with the best possible care we can give. Thank you for your consideration.